The cool May weather has pushed back this spring's allergy season, but rest assured it is on its way. Pharmacist Jamie Ikola joins us. Jamie, any idea when we might expect the big pollen boom at this time?
Well, I think it has already started. We have been seeing an increasing number of patients over the last few weeks presenting with allergy symptoms, some of them more severe than previous years, and some people that never had allergies in the past. But you're right, it's a little bit delayed this year, but they are expecting a big pollen boom, so a higher concentration of pollen in a shorter period of time, which may worsen allergy symptoms for those who suffer from them.
Is this an ongoing effect of climate change as well?
Yeah, there's a number of factors that influence pollen counts, but climate change is certainly one of them, with increasing levels of carbon dioxide and warmer temperatures, milder winters. There have been some talks that climate change has contributed to worsening allergy seasons over the last few seasons.
What can we do? What are some of the little things that we can do, the life hacks, as they call them?
Yeah, so I mean, there's a lot of things you can do to reduce pollen exposure. That's kind of the first line defense, obviously, is reducing the amount of pollen that you're exposed to if you do suffer from pollen allergies. So, for example, after it rains is a great time to go outside when the rain washes away the pollen. Pollen counts are also highest in the morning. So if you're going to be exercising outside, exercising in the evenings is preferable for those who suffer with pollen allergies. When you are inside, trying to keep the windows closed during those high pollen times, keeping the house clean and dusted after throughout the allergy season as well. And of course, washing your hands frequently when you're outside and trying to avoid touching your face, eyes, nose, those types of things.
As a pharmacist, I'm sure people consult with you all the time about ways to control their reaction to pollen. What are some of the things that you recommend?
Yeah, so I mean, in terms of once lifestyle modifications, pollen exposure hasn't worked, if you're still experiencing symptoms, there are a lot of options. Allergy medications can be kind of overwhelming. There's a lot to choose from in both the over-the-counter aisle as well as prescription options. So it's really important to consult with a healthcare professional, talk to your doctor or pharmacist about what options might be right for you. It's important to have an assessment to determine what type of symptoms you're having, whether it's predominantly eye symptoms, nasal symptoms, cough, or a combination of these types of symptoms to figure out which medication might be a good option. And then, we also have to take into consideration other medications you may be taking or underlying medical conditions to figure out which of the products may be a good fit for both the effectiveness and the safety.
I know there are a lot of over-the-counter allergy remedies available to people. Are they as good as prescription remedies?
Yeah, in some cases they are, depending on, what you've tried before or kind of, what other medications you're on or your underlying medical conditions. An over-the-counter option may be quite effective as a starting point for mild to moderate allergies. For severe allergy sufferers, many people who have tried these remedies, the over-the-counter options, they may require a prescription option. So there are many options to consider, but usually an over-the-counter medication is a good place to start if you're experiencing mild symptoms and haven't tried anything before.
Do you often recommend that they actually talk to their doctor about a referral to an allergist to pinpoint their symptoms and the causes?
Sometimes for more severe allergies or in children who maybe haven't been previously diagnosed. For patients who just experience them, a few weeks a year and their symptoms are mild, it may just be treatable over the counter or with a prescription option from a family doctor or from a pharmacist. But yeah, in more severe cases, sometimes, allergy shots or different remedies are required. So depending on the severity, that is sometimes required as well.